So before that, a quick rundown of the first five. We have the reinforcing, reducing, warming, clearing, and ascending. So for today, we will talk about descending. So what is the descending method? This is to make the upward perverted chi go down and to subdue the yang. So in other words, upward perverted chi, upward perverted flow of chi should be checked by descending method. For example, we need a stomach 36 to make the perverted chi of stomach descend. So for regulation of stomach by keeping its perverted chi to descend, we use points CV17, CV12, pericardium 6, and stomach 36, which we needle with even movement. So what is a rebellious chi or perverted chi? The symptoms of rebellious chi have to be distinguished according to the organ involved. Rebellious chi occurs when chi flows in the wrong direction, that is, a direction different than its normal physiological one. This varies from organ to organ as each has its own normal direction or flow of chi. So for the first point that we use, CV, CV17. It is a very important point to tonify chi. Moxibustion on this point is often used to stop smoking. So where is CV17? It is between the nipples, level with the fourth intercostal space on the anterior midline. We needle with transverse insertion pointed upward or towards the breast, 0.5 tune to 1.5 tune. We expect a sensation of local distension, soreness, or a deep, heavy feeling in the front of the chest. Next point is CV12. This is the front midpoint of the stomach. It's equally applicable for excess and deficiency. It is located on the anterior midline, fourth tune above the umbilicus. Needling is done perpendicular, 0.8 to 1.5 tune. Caution is observed in this point in thin patients as deep needling may penetrate the peritoneal cavity. Next point is pericardium 6. This is a major point for stomach, heart, and shen. This is also a major point to suppress nausea, stop vomiting, and relieve epigastric pain. PC6 is located 2 tune above the transverse crease of the wrist between the tendons of the palmaris longus muscle and the flexor carpi radialis muscle. We puncture this point perpendicularly, 0.5 to 0.8 tune. Caution should also be observed as the median nerve lies directly beneath this point, and needling it commonly induces a significant electric sensation. This is an acceptable manifestation of the chi or the arrival of chi, but once elicited, further manipulation is inappropriate and may damage the nerve. Next point is the very popular point, stomach 36, Susan Lee. It has a direct effect on the stomach. Located below the knee, 3 tune inferior to stomach 35, 1 finger breadth, lateral to anterior crest of the tibia. You could also locate this through locating first GB34. Stomach 36 lies 1 tune inferior and 1 finger breadth lateral to the anterior crest of the tibia. Or we can just locate this measuring 1 hand breadth below stomach 35. Needling is done perpendicular 1 to 1.5 tune. Next, use for the descending method is for soothing liver and subduing liver yang. We use the points GB20, liver 3, and kidney 1, needled with reducing method. So what is liver yang rising? The clinical manifestations for this are headache, which may be on the temples, eyes, or lateral side of the head, dizziness, tinnitus, deafness, dry mouth and throat, insomnia, irritability, feeling worked up, shouting in anger. The tongue will be red, especially on the sides, though may vary with underlying condition. The pulse will be wiry. Key symptoms for liver yang rising are headache, irritability, and a wiry pulse. So for the points we use, number 1 is GB20. It is the single most important point for headaches and dizziness, no matter what etiology or channels are involved. GB20 is also the major point for wind. It is located below the occiput, midway between DU16 and GB12, in the hollow between the sternocleidomastoid and trapezius muscles. We locate this point close to the base of the skull. This point is normally located at the most tender point of the hollow. Needling is done slight obliquely inferior in the direction of the channel, 1 to 1.5 tune. We can also do this with needling directed toward the tip of the nose, contralateral to the eyeball, or yintang, 0.5 to 1 tune. Caution is also observed here with deeper needling may damage the spinal cord. Next point is liver 3. Liver 3 comprises 2 of the 4 gates, the other 2 being LI4. This point is a total relaxation point. It is located on the dorsum of the foot and the hollow distal to the junction of the first and second metatarsal bones. We puncture this in the direction of kidney 1, 0.5 to 1.5 tune. Next point is kidney 1. This tonifies yin and reduces empty fire. We can massage kidney 1 before bed to treat insomnia. It is located on the sole of the foot in the depression when the foot is in plantar flexion, approximately at the junction of the anterior 1/3 and posterior 2/3 of the line connecting the base of the second and third toes and heel. Needling here is done perpendicular insertion, 0.5 tune. In general, descending method cannot be used for deficiency syndromes or deficiency syndromes in upper part and excess in lower part of the body.